United Concordia has produced this short video to help TRICARE Dental Program or TDP enrollees with their most common benefit questions. This video will answer your most common questions on the following benefits: wisdom tooth extraction and anesthesia, root canals, periodontal cleanings, and dental implants.
At my 17-year-old son's last routine checkup, his dentist recommended I contact an oral surgeon to have all 4 of his wisdom teeth extracted. Will I have a cost share for this type of service? Will the anesthesia be covered too?
The cost share for oral surgery to include wisdom tooth extraction varies by the sponsor's pay grade. If your sponsor's pay grade is an E1 through an E4, then your cost share is 30%. It's 40% for all other ranks. It's also important to note that wisdom tooth extraction has an age limitation. For patients under age 15 or over age 30, your dentist must submit a report to United Concordia that explains why the teeth need to be removed. As for the anesthesia, since wisdom teeth are being extracted, general anesthesia will be covered at 60% with a 40% cost share. Our payments are based on the allowance for each service and the remaining amount of the patient's annual contract maximum.
My dentist referred me to an endodontist for a root canal on one of my molars. How much will be covered, and does United Concordia need a copy of this referral?
You may contact an endodontist to seek treatment. No referral is needed from your general dentist. Root canal treatment is generally covered at 60%, so your cost share will be 40%. The TDP provides reduced cost shares for pay grades E1 to E4, in which case the cost share would be 30%. We recommend that you see a participating provider whenever possible, and our Find a Dentist application allows you to search by specialty within your zip code. Just because your general dentist is participating with your dental plan does not mean the specialist who refers you to will also be participating. You can locate Find a Dentist on the TDP website at TRICAREDentalProgram.com.
I was referred to a specialist for periodontal scaling and root planing. How much will be covered? Are there any age restrictions I should be aware of?
Periodontal scaling and root planing is a deep cleaning that extends below the gum line. The periodontal cost share for pay grades E1 to E4 is 30% and 40% for all other pay grades. Periodontal scaling and root planing is covered every 24 months in the same area of the mouth. Another question we get quite frequently is whether there is an age limit on periodontal scaling and root planing. There is no age limit, however, claims submitted for members under the age of 19 must be accompanied by x-rays and periodontal charting. This is because periodontal issues generally do not occur with frequency in younger patients.
Does the TRICARE Dental Program cover dental implants?
The TDP includes coverage for dental implants. You should discuss this with your dentist whether an implant is right for you. And keep in mind that a single implant will most likely use all of your $1,200 annual maximum. Additionally, you have a 50% cost share for dental implants. One way to determine your out-of-pocket expense is to ask your dentist to submit a request for predetermination when planning implant treatment. It is wise to include both the implant placement and the crown or other prosthodontic device you'll receive after the implant is in place. This process allows you and your dentist to know prior to treatment what will be covered by United Concordia as well as the anticipated payment amount. Remember, TDP predeterminations are valid for 6 months from the date of finalization. To request a predetermination, you or your dentist must submit a dental claim form and indicate on the form that a predetermination is being requested. The form should be submitted to United Concordia's Claims Department.
For additional information on specialty care benefits, please consult the TDP Benefit Booklet, available at TRICAREDentalProgram.com.